we've sort of started quantifying this in multiple settings. One of the first ones was adhesive capsulitis, and this is one of the first manuscripts that we are coming out with this stuff. But as you know, adhesive capsulitis is in general a clinical diagnosis. MRIs don't have reliable findings for it, and plain X-rays don't have reliable findings for it. So in general, when you have a frozen shoulder, you get diagnosed by it by an expert, a sports medicine or a shoulder expert in the clinic. Using this scapulohumeral rhythm measurements, we were able to compare 16 patients with adhesive capsulitis on the right compared to 32 patients matched for age and BMI on the left. You can see, just looking at the x-rays, there's an obvious difference in how the glenohumeral motion moves, as well as the scapulohumeral motion. You can see how much they compensate when you have that frozen shoulder. You can see that we matched it for age, BMI, and sex. And when you looked at those that had normal controls versus those that had adhesive capsulitis, the scapulohumeral rhythm was almost triple those of normal controls, which means that the glenohumeral motion is much higher in those with normal controls compared to those with adhesive capsulitis. Kind of makes sense, but this is the first time we've actually been able to actually quantify this in adhesive capsulitis and potentially give us some sort of objective measurement to diagnose this pathology. This shows in the first 30 degrees, second 30 degrees, and final 30 degrees how normal controls have a much higher scapulohumeral rhythm, so much higher glenohumeral motion compared to scapulothoracic motion compared to their normal controls. And I think these are kind of some cool graphs that John's intern was able to sort of put together over the summer, but you can see with the normal controls, the relatively sharp angle of the glenohumeral joint coming back, both in abduction and adduction, compared to the scapulothoracic joint, compared to a very flat glenohumeral angle in the adhesive capsulitis patient, compared to a much steeper motion of their scapulothoracic joint, just showing that they compensate with their scapula, as many of us assume, but nobody's ever really quantified.